Question 1. What is the first action the nurse should take when preparing to administer a high-risk medication to a patient? A. Verify the patient's identification and allergies. B. Double-check the medication order and dosage calculation. C. Ensure the patient understands the medication's potential side effects. D. Check the patient's lab results and vital signs. Answer. B. Double-check the medication order and dosage calculation. Rationale. High-risk medications require a precise dosage to avoid serious complications. Double-checking the medication order and dosage calculation ensures that the medication is safe and correctly prescribed. Identifying the patient and verifying allergies are important, but ensuring the right medication and dosage is critical when dealing with high-risk drugs. Question 2. In the case of a medication error, what is the nurse's primary responsibility? A. Notify the healthcare provider and document the error in the medical record. B. Assess the patient for adverse effects and report the error to the nursing supervisor. C. Discard the medication and administer the correct dose. D. Call the pharmacist to ask for advice and proceed. Answer. A. Notify the healthcare provider and document the error in the medical record. Rationale. The nurse's primary responsibility is to ensure patient safety, so they must immediately notify the healthcare provider of the error and document it appropriately. Assessing the patient is important, but the first step in the process is communication and proper documentation. Question 3. What should the nurse prioritize when administering medications to a patient with multiple health conditions and complex medication regimens? A. Administering the medications on time, regardless of interactions. B. Reviewing potential drug interactions and adjusting the administration order. C. Focusing solely on the patient's immediate symptoms. D. Relying on the healthcare provider's judgment for medication management. Answer. B. Reviewing potential drug interactions and adjusting the administration order. Rationale. In patients with complex conditions, it is crucial to assess potential drug interactions to avoid adverse effects. Administering medications on time is important, but understanding interactions and adjusting the regimen accordingly ensures patient safety and effectiveness of therapy. Question 4. When a nurse is administering a medication with a narrow therapeutic index, what is the most important step to ensure patient safety? A. Administer the medication slowly over time to monitor for adverse effects. B. Frequently monitor the patient's drug levels and adjust dosages as necessary. C. Follow standard dosage recommendations and administer the full dose. D. Educate the patient about common side effects and allow for self-monitoring. Answer. B. Frequently monitor the patient's drug levels and adjust dosages as necessary. Rationale. Medications with a narrow therapeutic index require precise monitoring of blood levels to ensure they remain within a safe and effective range. This prevents toxicity or underdose, as both extremes could harm the patient. Question 5. What is the most effective approach for preventing medication errors in a high-stakes emergency setting? A. Implement a double-check system for all medications administered. B. Follow an algorithmic approach to medication administration. C. Ensure that the patient is stabilized before administering any medications. D. Rely on the electronic health record (EHR) for error prevention. Answer. A. Implement a double-check system for all medications administered. Rationale. In emergency settings, quick and accurate medication administration is crucial. A double-check system involving another healthcare provider significantly reduces the likelihood of errors, particularly in high-stress situations. Question 6. When administering a medication with significant potential side effects, which action is most important for ensuring patient safety? A. Monitor for early signs of adverse reactions, including lab values and vital signs. B. Educate the patient on how to self-monitor for side effects after discharge. C. Adjust the medication dosage based on the patient's age and weight alone. D. Inform the patient of the risk of side effects, but proceed with administration. Answer: A. Monitor for early signs of adverse reactions, including lab values and vital signs. Rationale: monitoring for early signs of adverse reactions is vital when administering medications with significant side effects. Tracking lab results and vital signs allows the nurse to intervene promptly, preventing harm. Educating the patient is important, but does not replace the need for active monitoring. Question 7. What should the nurse do if a medication order appears to be unclear or incomplete? A. Administer the medication based on the previous dose prescribed. B. Contact the healthcare provider for clarification before proceeding with administration. C. Substitute a medication with similar action based on the patient's condition. D. Wait for the next shift nurse to clarify the order. Answer: B. Contact the healthcare provider for clarification before proceeding with administration. Rationale: when a medication order is unclear, the nurse must contact the healthcare provider for clarification before administering the medication. Administering the wrong drug or incorrect dose could result in patient harm. Waiting or substituting medications without confirmation could lead to serious errors. Question 8. Which of the following is an essential component of patient education related to medication safety? A. Ensuring the patient understands how to take the medication at the prescribed times. B. Providing information about how to store the medication properly. C. Instructing the patient to report any adverse effects, even if mild. D. All of the above. Answer: D. All of the above. Rationale: patient education should include all aspects of medication safety, including proper administration times, storage, and adverse effect reporting. Providing comprehensive information empowers patients to manage their medication safely and improves treatment outcomes. Question 9. What is the most effective strategy for reducing the risk of medication errors in a busy hospital unit? A. Rely on automated dispensing systems to reduce human error. B. Limit the number of medications a nurse is responsible for administering. C. Implement barcode scanning for medication administration verification. D. Encourage patients to be responsible for their own medication tracking. Answer: C. Implement barcode scanning for medication administration verification. Rationale: barcode scanning helps ensure the right medication is administered to the right patient by verifying the medication and dosage in real time. This system significantly reduces the risk of human error in high-pressure environments. Question 10. What is the nurse's role in managing polypharmacy in older adult patients? A. Simplify the medication regimen by discontinuing unnecessary medications. B. Monitor for adverse drug reactions and interactions regularly. C. Educate the patient about the importance of following the prescribed medication schedule. D. All of the above. Answer: D. All of the above. Rationale: managing polypharmacy involves evaluating the patient's entire medication regimen to identify unnecessary drugs, monitoring for drug interactions and side effects, and educating the patient on adherence. All these strategies are necessary to ensure safe and effective medication use in older adults. Question 11. A patient with renal failure is prescribed a medication that is cleared by the kidneys. What action should the nurse take before administering the medication? A. Administer the medication as prescribed, without modification. B. Assess the patient's renal function and adjust the medication dosage accordingly. C. Contact the healthcare provider to ask if the medication can be withheld. D. Administer the standard dosage and monitor the patient for any side effects. Answer: B. Assess the patient's renal function and adjust the medication dosage accordingly. Rationale: patients with renal failure may require dosage adjustments for medications eliminated by the kidneys. Failure to adjust the dose could result in drug toxicity. Monitoring renal function and adjusting the dose is critical for patient safety. Question 12. A nurse is about to administer a high-alert medication via intravenous push. Which of the following actions is most crucial for ensuring patient safety? A. Double-check the medication with a colleague before administration. B. Verify the patient's identity and allergies with the medication record. C. Confirm the rate of infusion and flush the IV line before administration. D. Ensure the patient is positioned correctly in bed for the procedure. Answer. A. Double-check the medication with a colleague before administration. Rationale. High-alert medications have a higher risk of causing harm if administered incorrectly. A double-check system with a colleague can prevent administration errors, ensuring that the correct drug and dosage are administered safely. Question 13. A patient receiving chemotherapy develops an allergic reaction to the prescribed medication. What is the nurse's immediate priority action? A. Discontinue the medication and notify the healthcare provider immediately. B. Administer the prescribed antihistamines and proceed with treatment. C. Document the reaction and continue the chemotherapy session. D. Reassure the patient that the reaction is normal and will resolve. Answer. A. Discontinue the medication and notify the healthcare provider immediately. Rationale. The first priority in managing an allergic reaction is to discontinue the medication and notify the healthcare provider for further instructions. Administering antihistamines or continuing the medication without consultation could worsen the reaction. Question 14. A nurse is administering a sedative to an elderly patient who has multiple comorbidities. What is the nurse's best approach to ensure the patient's safety? A. Administer the full prescribed dose and monitor for any signs of oversedation. B. Start with a lower dose, observing for side effects, and adjust based on the patient's response. C. Give the sedative only when the patient requests it, to avoid oversedation. D. Withhold the sedative and contact the healthcare provider for alternative medications. Answer. B. Start with a lower dose, observing for side effects, and adjust based on the patient's response. Rationale. Elderly patients often have altered pharmacokinetics, making them more susceptible to medication side effects. Starting with a lower dose and adjusting as needed helps to minimize the risk of oversedation or other adverse effects. Question 15. A nurse is preparing to administer an insulin injection to a patient with diabetes. The patient expresses concern about the needle pain. What is the nurse's best response? A. Ignore the patient's concern and proceed with the injection as quickly as possible. B. Educate the patient on the importance of insulin and provide reassurance. C. Use a larger needle to ensure the medication is delivered more quickly. D. Delay the injection until the patient feels more comfortable. Answer. B. Educate the patient on the importance of insulin and provide reassurance. Rationale. Educating the patient about the need for insulin and offering reassurance can reduce anxiety and improve cooperation. Quick administration of the medication is important, but addressing the patient's concerns helps promote a positive experience. Question 16. A nurse is administering a medication to a patient with a history of substance abuse. What precautionary measure should the nurse take before administering the medication? A. Withhold the medication if the patient appears agitated. B. Monitor the patient closely for signs of misuse or withdrawal symptoms. C. Administer the medication as prescribed without any changes. D. Encourage the patient to take the medication in front of the nurse to ensure compliance. Answer. B. Monitor the patient closely for signs of misuse or withdrawal symptoms. Rationale. Patients with a history of substance abuse may be at higher risk for medication misuse or withdrawal symptoms. Close monitoring is essential to ensure safe use of prescribed medications and to manage any adverse effects promptly. Question 17. A nurse is administering a medication that can cause orthostatic hypotension. What should the nurse instruct the patient to do before getting out of bed after taking the medication? A. Stand up immediately, as the medication will wear off quickly. B. Sit on the edge of the bed and rise slowly to prevent dizziness. C. Drink a large glass of water to counteract any dizziness. D. Take the medication on an empty stomach to reduce side effects. Answer: B. Sit on the edge of the bed and rise slowly to prevent dizziness. Rationale: orthostatic hypotension can cause dizziness or fainting upon standing. Instructing the patient to sit on the edge of the bed and rise slowly helps to reduce the risk of falls and minimize symptoms of low blood pressure. Question 18. A nurse is administering a medication to a patient with an allergy to penicillin. Which action is most critical for the nurse to take? A. Proceed with the medication administration, as it is not related to penicillin. B. Verify the patient's allergy and confirm that the prescribed medication is safe. C. Administer a smaller dose of the medication to reduce the risk of an allergic reaction. D. Delay the medication administration until the healthcare provider is contacted. Answer: B. Verify the patient's allergy and confirm that the prescribed medication is safe. Rationale: verifying the allergy history and ensuring the medication does not contain penicillin or related substances is critical. Even if the drug appears unrelated, it is important to prevent any potential allergic reactions. Question 19. A nurse is preparing to administer a medication that the patient has previously refused. What is the most appropriate approach for the nurse to take? A. Administer the medication anyway, as it is prescribed. B. Assess the patient's reasons for refusing and address concerns before administration. C. Discontinue the medication and notify the healthcare provider of the refusal. D. Persuade the patient to take the medication by emphasizing its benefits. Answer: B. Assess the patient's reasons for refusing and address concerns before administration. Rationale: it is essential to understand why the patient refuses the medication and to address any concerns or misconceptions. This ensures informed decision-making and promotes patient autonomy while maintaining safety. Question 20. A patient is receiving a medication that requires periodic lab tests to monitor for adverse effects. What is the nurse's responsibility regarding these tests? A. Instruct the patient to schedule lab tests independently. B. Ensure the patient has completed the tests and communicate results with the healthcare provider. C. Document the test orders and leave it to the laboratory staff to follow through. D. Remind the patient about the tests, but do not follow up. Answer: B. Ensure the patient has completed the tests and communicate results with the healthcare provider. Rationale: the nurse is responsible for ensuring that the patient completes necessary lab tests and that the results are communicated to the healthcare provider for further action. This is crucial for monitoring adverse drug effects and adjusting the treatment plan as needed. Question 21. A nurse is administering a medication that requires an IV push to a critically ill patient. The patient suddenly shows signs of an allergic reaction. What should the nurse do first? A. Discontinue the medication and monitor for further symptoms. B. Stop the infusion immediately, assess the patient, and administer appropriate emergency medications. C. Increase the infusion rate to flush out the medication faster. D. Call the healthcare provider and wait for instructions. Answer: B. Stop the infusion immediately, assess the patient, and administer appropriate emergency medications. Rationale: the nurse's first priority is to stop the infusion immediately to prevent further exposure to the medication. Then, assessing the patient and administering emergency medications, like antihistamines or epinephrine, are critical to managing the allergic reaction. Question 22. A patient with a history of stroke is prescribed a new anticoagulant. What is the most important nursing action before administering the medication? A. Educate the patient about the need for regular INR monitoring. B. Verify the patient's renal and liver function tests to ensure medication safety. C. Ask the patient about any known allergies to medications. D. Instruct the patient to stop all other medications before starting the new anticoagulant. Answer. B. Verify the patient's renal and liver function tests to ensure medication safety. Rationale. Anticoagulants can pose a risk for bleeding, especially in patients with impaired renal or liver function. Verifying renal and liver function tests ensures that the medication is metabolized and excreted safely, minimizing risk. Question 23. A nurse is administering a sedative to a patient who is also on opioid pain medications. What is the primary concern for the nurse in this situation? A. The patient may experience excessive sedation, leading to respiratory depression. B. The patient may experience confusion due to drug interactions. C. The patient may not respond to the sedative, requiring an increased dose. D. The patient may develop gastrointestinal disturbances, such as nausea. Answer. A. The patient may experience excessive sedation, leading to respiratory depression. Rationale. Both sedatives and opioids have central nervous system depressant effects, and when taken together, they can lead to respiratory depression, which can be life-threatening. Monitoring the patient closely for signs of oversedation and respiratory distress is critical. Question 24. A nurse is administering a medication that could cause hypotension. The patient's blood pressure is already low. What is the nurse's next step? A. Proceed with the administration and monitor the blood pressure frequently. B. Withhold the medication and consult the healthcare provider for guidance. C. Increase the infusion rate of fluids to counteract the hypotension. D. Notify the healthcare provider and suggest an alternative medication. Answer. B. Withhold the medication and consult the healthcare provider for guidance. Rationale. In patients with pre-existing hypotension, administering medications that can further lower blood pressure may worsen the patient's condition. The nurse should withhold the medication and seek guidance from the healthcare provider before proceeding. Question 25. A patient is receiving chemotherapy and is at risk for infection. What is the most important nursing intervention regarding the patient's medication regimen? A. Administer prophylactic antibiotics as prescribed to prevent infection. B. Educate the patient about signs of infection and the importance of early reporting. C. Adjust the chemotherapy dosage based on the patient's white blood cell count. D. Ensure the patient is receiving adequate hydration to support the immune system. Answer. A. Administer prophylactic antibiotics as prescribed to prevent infection. Rationale. Patients receiving chemotherapy are at high risk for infections due to immune suppression. Prophylactic antibiotics help reduce this risk and prevent serious infections. Educating the patient and ensuring hydration are important, but administering prophylactic antibiotics is the priority. Question 26. A nurse is administering a medication to a pediatric patient with a history of asthma. The medication is known to cause bronchodilation. What should the nurse monitor for after administration? A. Signs of increased respiratory effort and wheezing. B. Changes in blood glucose levels due to medication side effects. C. Decreased oxygen saturation and increased heart rate. D. Any signs of gastrointestinal upset or discomfort. Answer. A. Signs of increased respiratory effort and wheezing. Rationale. Bronchodilators can cause side effects such as tachycardia and arrhythmias, but they are primarily used to improve airway patency. Monitoring for increased respiratory effort or wheezing in asthma patients helps detect early signs of potential complications. Question 27. A nurse is administering a medication that could cause drowsiness. The patient is scheduled for physical therapy after the medication is given. What is the most important intervention the nurse should take? A. Inform the physical therapist about the medication's sedative effects. B. Ensure the patient is well rested before administration to minimize drowsiness. C. Allow the patient to rest and skip the physical therapy session. D. Encourage the patient to complete the physical therapy session despite the medication. Answer. A. Inform the physical therapist about the medication's sedative effects. Rationale. Communication with the physical therapist is essential to ensure patient safety. If the medication is expected to cause drowsiness, the therapist can adjust the therapy to accommodate the patient's condition and reduce the risk of injury. Question 28. A nurse is administering a medication that requires the patient to remain upright for 30 minutes after ingestion. The patient is confused and unable to sit upright. What is the most appropriate action? A. Administer the medication and allow the patient to lie down immediately after. B. Postpone the medication until the patient can sit up properly. C. Administer the medication while the patient is lying down, ensuring comfort. D. Contact the healthcare provider to change the medication regimen. Answer. B. Postpone the medication until the patient can sit up properly. Rationale. Some medications require the patient to remain upright to prevent complications, such as esophageal irritation or ulcers. It is important to postpone administration until the patient is in the proper position to avoid harm. Question 29. A nurse is caring for a patient who is receiving a new medication regimen. The patient reports feeling dizzy and lightheaded. What should the nurse do first? A. Assess the patient's vital signs, particularly blood pressure. B. Withhold the medication and notify the healthcare provider. C. Document the complaint and monitor the patient for further symptoms. D. Provide the patient with a snack to increase their energy levels. Answer. A. Assess the patient's vital signs, particularly blood pressure. Rationale. Dizziness and lightheadedness can be indicative of hypotension, which may be related to the medication. Assessing the vital signs, especially blood pressure, will help determine if the medication is causing the symptoms and guide appropriate interventions. Question 30. A patient with a history of renal failure is receiving a medication that is renally excreted. What should the nurse monitor closely? A. Electrolyte levels and renal function tests. B. Hemoglobin and hematocrit levels. C. Blood glucose levels and serum protein. D. Liver enzymes and albumin levels. Answer. A. Electrolyte levels and renal function tests. Rationale. Medications that are excreted by the kidneys can accumulate in patients with renal failure, leading to toxicity. Close monitoring of electrolyte levels and renal function tests helps detect potential complications and allows for timely adjustments to the medication regimen. Question 31. A nurse is about to administer a new medication to a patient with a history of hypersensitivity reactions. What should the nurse do first? A. Administer the medication and observe for any adverse reactions. B. Verify the patient's allergy history and ensure the medication is not contraindicated. C. Administer the medication with an antihistamine to prevent allergic reactions. D. Call the healthcare provider to confirm the medication choice. Answer. B. Verify the patient's allergy history and ensure the medication is not contraindicated. Rationale. The first step in preventing a hypersensitivity reaction is ensuring that the prescribed medication does not contain allergens or ingredients the patient is sensitive to. Verifying the allergy history before administering any medication is essential. Question 32. A patient with cirrhosis is prescribed a medication that is metabolized by the liver. What action should the nurse take before administering the medication? A. Administer the medication as prescribed and monitor for side effects. B. Contact the healthcare provider to request dosage adjustment based on liver function tests. C. Withhold the medication and inform the healthcare provider. D. Double the dose to ensure the patient receives the full therapeutic effect. Answer: B. Contact the healthcare provider to request dosage adjustment based on liver function tests. Rationale: liver impairment can alter the metabolism of drugs, potentially causing toxicity. Contacting the healthcare provider to adjust the dose based on liver function tests ensures the medication is safe and effective. Question 33. A patient is receiving a hypotassium medication. What should the nurse monitor closely to ensure patient safety? A. Serum potassium levels and ECG changes. B. Liver function and platelet count. C. Blood pressure and heart rate. D. Oxygen saturation and respiratory rate. Answer: A. Serum potassium levels and ECG changes. Rationale: hypotassium medications can cause hyperkalemia, which can lead to dangerous arrhythmias. Monitoring serum potassium levels and ECG changes allows for early detection of any adverse effects. Question 34. A nurse is about to administer a medication that is known to cause severe gastrointestinal irritation. What should the nurse instruct the patient to do to minimize this risk? A. Take the medication on an empty stomach for better absorption. B. Take the medication with food or milk to reduce irritation. C. Drink a large glass of water before taking the medication. D. Lie down after taking the medication to prevent nausea. Answer: B. Take the medication with food or milk to reduce irritation. Rationale: taking medications that irritate the gastrointestinal tract with food or milk helps buffer the stomach lining, reducing irritation and preventing nausea or ulcers. Question 35. A patient who is prescribed a new medication develops a rash and reports difficulty breathing. What is the nurse's first action? A. Document the rash and continue to monitor the patient for other symptoms. B. Discontinue the medication immediately and provide the patient with an antihistamine. C. Assess the patient's airway, discontinue the medication, and administer emergency treatment. D. Call the healthcare provider and wait for instructions. Answer: C. Assess the patient's airway, discontinue the medication, and administer emergency treatment. Rationale: the development of a rash and difficulty breathing suggests an allergic reaction, potentially anaphylaxis. The nurse must immediately assess the patient's airway, discontinue the medication, and provide emergency treatment, e.g. epinephrine, to prevent severe complications. Question 36. A nurse is administering a medication that requires the patient to avoid grapefruit juice due to potential drug interactions. The patient states they have just consumed grapefruit juice. What should the nurse do? A. Administer the medication and monitor the patient closely for side effects. B. Withhold the medication and consult the healthcare provider for an alternative. C. Administer a lower dose of the medication to counteract the effects of grapefruit juice. D. Provide the patient with water and continue with the medication as planned. Answer: B. Withhold the medication and consult the healthcare provider for an alternative. Rationale: grapefruit juice can interfere with the metabolism of certain medications, leading to increased drug levels and potential toxicity. The nurse should withhold the medication and consult the healthcare provider for guidance. Question 37. A nurse is administering a medication that could cause a QT interval prolongation. What is the most important action for the nurse to take before administration? A. Ensure the patient is on a cardiac monitor and check baseline ECG. B. Provide the patient with a beta blocker to counteract any heart rate issues. C. Check the patient's potassium and magnesium levels before administering the medication. D. Educate the patient about potential dizziness and monitor for symptoms. Answer: A. Ensure the patient is on a cardiac monitor and check baseline ECG. Rationale: QT interval prolongation can lead to serious arrhythmias. Monitoring the patient with an ECG and cardiac monitoring is essential to detect changes in heart rhythm early. Question 38. A nurse is preparing to administer a medication to a patient with a history of depression. What should the nurse be most cautious of when administering the medication? A. The potential for the patient to develop sedation and drowsiness. B. The risk of the medication interacting with antidepressants. C. The likelihood of the patient developing gastrointestinal side effects. D. The possibility of the patient becoming non-compliant with the medication regimen. Answer: B. The risk of the medication interacting with antidepressants. Rationale: drug interactions, especially with antidepressants, can cause serious complications like serotonin syndrome or other adverse effects. The nurse should assess potential interactions before administering any new medication. Question 39. A nurse is caring for a patient who is receiving a high-dose corticosteroid. What is the nurse's most important intervention to prevent complications? A. Monitor the patient's blood sugar levels and electrolytes regularly. B. Encourage the patient to eat a high-sodium diet to balance fluid retention. C. Increase the patient's fluid intake to prevent dehydration. D. Educate the patient about signs of infection and encourage early reporting. Answer: A. Monitor the patient's blood sugar levels and electrolytes regularly. Rationale: high-dose corticosteroids can cause electrolyte imbalances and increase blood sugar levels. Monitoring these parameters ensures that any adverse effects are identified and managed early. Question 40. A nurse is administering a new medication to a patient with chronic liver disease. What is the most important step the nurse should take to ensure the medication safety? A. Administer the medication as prescribed and monitor the patient for any side effects. B. Verify the liver function tests before administration and consult the healthcare provider for dosage adjustment. C. Increase the medication dose to compensate for the liver disease. D. Withhold the medication until the liver function normalizes. Answer: B. Verify the liver function tests before administration and consult the healthcare provider for dosage adjustment. Rationale: chronic liver disease can impair drug metabolism, increasing the risk of drug toxicity. The nurse should verify liver function tests and consult the healthcare provider to adjust the medication dose appropriately. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!